ASHHRA listeners, welcome to another episode of the ASHHRA podcast. I'm your co-host, Luke Carignan, here with your other dynamic co-host, Bo Brabo. Bo, I'm excited about today's show. Are you pumped, brother?
I am. I have some great questions lined up.
You got some great questions? All right. We're here with the Senior Vice President of HR at Universal Health Services. Are you familiar with Universal Health Services, Bo?
I'm not, but after today, I hope that I'm intimately familiar with them.
You should be. You might be and might not even know it. They
That's
operate 350 locations around the United States, almost 100,000 employees.
Wow.
So not small potatoes. So this person's job is not like, I wouldn't say it's one where you just like sit back and kind of runs itself. Not that type of HR job, right?
Right.
So please join me in welcoming Maria Zangardi to the show. Maria, welcome.
Thank you so much. So glad to be here and so glad to meet both of you.
We're pumped that you're here. Maria, to kick us off, will you give us like a Twitter bio of your background and just your career journey to date?
Sure, absolutely. Well, first of all, at Universal Health Services, I've been here a little over 6 years. And just to give some of the listeners some perspective, so we're in 39 different states, Puerto Rico and the UK. So about 400 plus different entities in acute care, behavioral health, outpatient clinics, and even a health plan. And so, we serve about 3.6 million patients every year. And we just celebrated our 45th anniversary. And so I couldn't be more proud to work for this organization because it's amazing to see the level of care, all of our hospitals that are leapfrog A's. So very, very proud of that. And, I kind of fell into human resources. A lot of HR folks that happens to, and I fell in first in the recruitment space, working in gaming and hospitality, which was a wonderful place to start in HR, and spent 11 and a half years working for the Mohegan organization. And what was great about that is I got to not only work in HR all the way up through the senior level position, but working in operations as well. And I think in that 24/7, 365 environment, you learn so much about service, and being an operator in that was priceless for me in my career. So that's a little bit about my background. Started in gaming and hospitality before moving to healthcare, and then now spending the last 6 years with UHS, which is one of the most mission-driven organizations I could ever hope to be a part of.
That's so cool. Tell us a little bit more about that mission as well.
Yes. So I think, 45 years UHS has been operating, and it was founded on one premise and one premise alone, which is that we need to provide superior patient care. There's a need here, and we need to fill that. And that's both in that acute care and med surg space, behavioral health being one of the largest behavioral health providers in this country. And, the growth trajectory has been amazing over those 45 years. And I think being in our hospitals, and that's one of the things that I've been really passionate about when I first started here and working in the behavioral health space, mostly in HR. First thing I did was go to our hospitals and hear directly from patients about the care they were receiving and how it's changing their lives. And even moving up through the organization, spending time in our acute care hospitals most recently, and being there talking with a leader in our NICU, and that person telling me about the families that came back, and seeing a 23-week-old baby, and that NICU nurse telling me this baby and their family will come back when they're toddlers and show us their coloring books and all of the things that they're doing. It's just so powerful. And that's a lot about our organization. You can just see the passion no matter which one of our hospitals you go to.
That's amazing.
That's so powerful.
It is. Superior is a big word. Like, that's a big order to get right.
It is.
It's a big, big goal. So I'm curious, Maria, you're in the behavioral health space, right? And to achieve superior, everybody has to be like hitting on all cylinders every day, right? The right behaviors, which to get there, there's just like no other way to get there. Do you use your behavioral health specialists to help you all figure out, like, what are the behaviors we need to see from every role, every person in the organization if we're actually going to achieve superior patient care.
Yes, absolutely. I think that's one of the things, all of those individuals are involved in our competency models, and we've done these focus groups on what are the competency models that you need. And I think what's powerful is that many of our vice presidents that serve in this organization right now are individuals who started as a mental health technician, or a medical records clerk, or a speech language pathologist. We have that time and time again that they've grown up from a mental health technician to a risk manager, or from a risk manager to a director of quality, and then in our COO and training program, and became a CEO. We've had HR directors actually who've gone into that program and are now hospital CEOs. So a lot of what has blossomed in this organization is exponential growth from within. And so you have all of these leaders who very much lived what that direct patient care is like every day. That helps you really define what service excellence looks like, what superior patient care looks like. And I think that's the great thing about our organization. I can go through the countless VPs and say, wow, this is the VP who started as a medical records clerk, and here's our vice president who started as a mental health technician. And that really helps you define a great competency model.
That's amazing.
I love that. I love that. Maria, I want to dive in a little bit. And just, I want to know how you set up your day for success. So listeners, Maria has been promoted 3 times in 6 years at UHS to the top HR role. And she has the exact same amount of minutes in the day as you do. And still probably it's 100,000 employees, right? The emails are probably insane. Like, I can't imagine what the inbox is like. How do you structure your day? Are there any like battle rhythms you get into? Bo and I are really big about like what healthy rhythms do we get into to set ourselves up for success. So how do you do it? Or do you have any patterns that you do? Or
I think there are patterns, right? Like first thing in the morning, we go and take the dogs out for a walk really early, or may hit the gym a couple of days a week, right at 5 a.m. And one of the things I love to do is sort of be in the office early when it's like quiet and no one's here. It's also good when you want to surprise people with a little note or a gift or something like that they walk into. And so that's one of my things, is trying to be kind of, really early, first one here, because it does help you get that reset, helps you check all of those emails that you might want to catch up on. And then there's like a little kind of thing that I do at night too, which is kind of just log in and think about what I want to set for the next day. It actually, when people talk about that work-life balance, I think of it as work-life integration. I've kind of loved to really work from a young age. And so to me, I do those little things that are kind of my, feeling kind of caught up right before the day starts, and then also feeling prepared before the next day starts. And I think that's my secret.
Oh, I love it.
Well, we need to make that secret. Luke and I talk about it all the time, like very public, and we need to help others ditch work-life balance. Because Luke and I like the word harmony, but it's integration. I mean, we look at it from we're people. We bring our whole self to work. We take our whole self home. It's just life, and which makes it so important that you are finding the right organization that fits you. Your values align, your cultures align, because it is going to integrate. And I think people are, when you figure that out, Maria, I know Luke and I have, you're happier.
Yes.
Like your family's happier. You take care of things when you need to take care of things, and you're not always struggling on the teeter-totter to balance the two.
That's absolutely right.
It's impossible. Yeah.
I had a mentor a long time ago that, said the very first thing, like, life's short, work happy, right? And if you're not, then you have to find what that might be. And that could be a journey, right? I fell into HR, fell in love with it. I was getting my master's in counseling, thinking I was going to be maybe a school counselor or something. And, it just so happened it was kind of hard to get into some of those jobs. So kind of then stayed in recruiting and HR and moved up.
Mm-hmm.
But that's one of the things I always say to people. My degree was in mass communications. I came out of high school not exactly knowing what I wanted to do. I knew I wanted to play a sport in college. That was for sure. And then everything else was kind of like, okay, I'll figure it out along the way. And so, some of that is making sure that no matter what you do, you kind of find out, is this driving me? Do I feel passionate about it? Can I get excited about it? And I always would do that recheck with myself.
Mm-hmm. I think that's fantastic.
Yeah.
HR does a lot of unlicensed therapy and
Mm-hmm.
counseling. So I think you have the right degree for
Right.
sure. Yep.
Yeah, Maria, we are about to jump out of our chairs when you mentioned work-life integration. It's like half of what we talk about on here. We don't believe in work-life balance. We're like, to me, it's like, well, should I sacrifice work for my family or sacrifice my family for work? And to me, I'm like, no, that's a losing proposition. I'm never going to be able to do that. So the fact that you say that, also, I think, Bo and I have interviewed hundreds of C-levels on here and just very successful people. And I've come to realize that almost all of them have a certain trait and energy about them that I think comes into the patterns they keep and work-life integration. But then I started thinking, well, they're not that way because they have a good position and they rose to the top. They rose to the top because they're inherently that way. And I think it goes into the mindset that they have and that people are attracted to that and energized by it. Like how you mentioned getting there early and leaving people like notes telling them good job or thank you. Like, my gosh, like that's how you get people on board to go that extra mile. So kudos to you. That's huge and something so little and easy.
Yeah. And to be honest, it's interesting because I think one thing I would say, anytime you look to lead, you have to serve first, right?
Yeah.
And I think that was the other thing that I really loved about being in operations is that serve first mentality, and then you're happier, you
Mm-hmm.
know? And I think, of course, in HR, you have to do sometimes difficult things or, it could be challenging, but if you really understand the why behind everything that you're doing, it just helps. And so I reflect on that a lot too.
Oh, that's so cool.
Yeah.
That's so
What
cool.
I've always found, if you have that attitude of service or you're a servant leader or and that's how you show up every day, it's such a different way for people to see you. So even if your performance, even if you mess something up, but your heart's in the area of service, man, your comeback from it can be so simple.
Yes.
It's one of those things. But if it's not there, then it's a different story.
It's so funny that you mentioned that because I think it is. You learn a lot from the mistakes that you make or
Mm-hmm.
some of the stumbling blocks that you have. And I tell people this story because it's funny, one, but two, it kind of made me be real vigilant when it comes to, getting, business acumen and looking at suppliers and reading contracts. But a long time ago, I was whatever, maybe 22 years old first, or 23, working, and we're trying to open the first casino in the state of PA. And I'm kind of the employment specialist doing all the recruiting. And I get a call from a vendor who is like, hey, you know what? We have this special on the toner. We noticed that yours is low. You haven't done an order. And like, meanwhile, at this time, we're printing because you had a paper print all of these gaming licenses and actually take to the gaming control board in Harrisburg. We were the first. So, can't have the printers run out or the toners. Well, turns out it was one of those toner scams that was happening like many, many years ago. And so I had to kind of go into my boss at the time and say, I just realized like we got because the toner didn't show up. I was like, we got toner scammed and I did it. Right. And we kind of laughed about it because he's like, I bet you'll learn, who's our vendors, right? Because we're doing everything in such a hurried way to get this open on time and under budget. But it's one of those things that I learned a great lesson there, right? Like,
Yeah.
let me double check, let me get into the details. And it was a great lesson at 23. So I tell people all the time that story because it's like we all make some of these mistakes and then you kind of learn something from it and it's good.
It's great. I mean, there's so much to pull out of that experience that you had. Maria, because you went to your boss. You didn't try to hide anything, but it's that hard. Like, I'm trying to do the right thing, right? And we had a guest tell us, I thought it was great in the past. Heart recognizes heart,
Yeah.
right? So your heart's in the right spot, and your boss knew that, right? And now you learn from it, you move on, right? It's such a game changer in the workplace. Amazing.
It really is. It really is. Also, I want to talk about Universal Health Services just got recognized as an employer of choice by American Opportunity. This just happened like a month ago, which is amazing to me as well, because I get back to what I said at the beginning. It is, folks, it is easier for companies when you just have one solid brand and you're at one location. It is, all right, it's okay, it's difficult anywhere. It's way harder over here to do it with that type of structure. What went into getting that? Tell us a little bit about it, because that's a big accomplishment.
Yes, so I think, we're really proud of that because, not only are we in the top 100 in that American Opportunity Index, but number one in the healthcare provider sector.
Right.
And what that is they scour data across people's profiles, people's jobs, people's work history, and all the information that is out there. So it's this objective review of all that information and then listing the top companies for people from a perspective of culture and growth and opportunity and diversity and inclusion. That is great because what they've recognized us for in some of the areas where we're really high is that opportunity, is that career growth, is that trajectory of people moving up. And you see that in so many people's careers. I'm lucky enough to have been one of them that has been mentored here at UHS. But as I mentioned, it's evident to the public that people have moved up through mental health technician to a risk manager to a director to a COO to a VP, or somebody who's been a nurse to a nurse manager to a CNO. And that's happened throughout all of our different hospitals and entities on both sides of acute and behavioral health. And so really it's a recognition we're proud of because we know that that's going on, but for the data that's out there that's been scoured to demonstrate that, it just validates how we know and feel about the organization here.
Yeah, how much do you think that career pathing, if you will, has helped in your retention numbers?
Yeah, I think that it's a lot. I mean, we just had our, all employee meeting before the end of the year and recognized service anniversaries. And you look at the folks that have been with us, 5+ years, 10+ years, 20+ years, 25, 30, 35 years, 40-year anniversaries that we're celebrating. And I think that's it. I have a colleague here that went to the same college as I did, and we knew each other when we were both kind of kids. And UHS was her first job out of college, and she's still here in a leader position with UHS many years later, having grown up, and very active in all of our team care events that we have and leading them. And you just see person after person who came into UHS and grew and stayed here. And what I said at that all employee meeting was, I hope to be celebrating, God willing and everything, that I'll be here for 30, 40 years celebrating those kind of things, right? And like all of those individuals were. So, I think it really does help with retention, and it's amazing to hear people's career journeys when you sit down and talk with them from here. And it's just powerful.
No, for sure.
And by the way, listeners, in the medical care sector, they were number one out of their sector in medical care. So how about that? Wasn't even just making the list. I mean, being number one in that sector is pretty awesome. There's some stiff competition.
Yes, thank you. We're proud of that for sure.
As you should be. And I've noticed that just in the folks that I've interacted with, now that you mention it, whenever I come across someone from UHS, it's either like, wow, they've been there a long time, right? Which says something. Or like I have a coworker, he's like, oh, my brother works at UHS. And I'm like, oh, how's he like it? And he's like, he loves it. It's like end of conversation. That was it. Just he loves it. I'm like, wow, that's telling.
Thank you. We love to hear that too, and I think it's great.
That's really cool. Tell me as well. I was wondering about your COO in training programs. That's really interesting to me. That I don't ever. Bo, have you ever seen a COO in training program?
No, I have not.
No, right?
I've seen a lot of like general manager training programs, outside of healthcare, but COO in training, I don't think I ever have.
Sounds like it could be important.
It,
So
it's
Maybe.
great. We love it. I mean, and recently it's interesting because we just had a rash of promotions, folks going from COO in training to then taking on their own hospital, being CEO. And so that program is great. We've had so many folks come through it, many of our current CEOs and VPs, as I mentioned. But what it is somebody who has the experience in healthcare. Maybe they've been working as a risk manager, risk director, director of quality, or even an HR director who, knows the lay of the land now at the hospitals. But what are all the other things that they may need to know in clinical services, business development? They get partnered with a mentor CEO at a hospital. And they may rotate several hospitals where they have those mentor CEOs, and they're in that program and going through specific modules along the way. So they're in cohorts. We call it L3, and it has a lot of focus on the innovation, the learning, the business acumen that they need to develop to become a CEO. And so some the time in the program may be flexible depending on the learning and the ramp that might be needed, but we really invest in not only the hands-on learning and having a mentor, but then also some of the module and training learning, professional development learning that somebody would need to become a CEO.
That's awesome.
It's so cool.
Super awesome.
Yeah, because I mean, in any organization, the higher up you get on the ladder, the less training resources there are going to be anywhere. When you get to the C-suite, my gosh, I mean, just in our own economy today, in life, there's very few resources. Now it's gone to like executive coaches and things like that, which I understand, but the only downside of that is they can only share their experiences from a different organization. And it's never going, I mean, it's good, but it's never going to jive perfectly with like that culture and what you're doing internally. So I just find that really fascinating. I haven't seen that before.
Yes, and I tell people all the time, I wish I knew half the things when I was going to college that were out there. But if I were going to college now and I really wanted to be, mission driven healthcare, an industry that is always going to be so needed and so necessary, doing good work. I mean, those opportunities are endless. I'd be seeking out, an organization like UHS. And I guess that maybe is my plug because we're always recruiting, right? That's one of the things from a young age, always recruiting. But it really is a great program. And then we do these sort of what we call 120 feedback letters where our president of like our behavioral health division, our president of our acute care division, they send these letters to those new leaders to get the 120-day feedback of how's it going? How's the support? And so I love that because it's two-way. Not only are we giving the training, the content, the mentorship, but then it's like, okay, how are we doing with the training, the content, the mentorship?
Yeah,
Wow.
It's very intentional, right?
Yes.
Yeah.
Maria, I really want to dive in more. I keep going back to this topic, but I love it. But so to help the other HR folks there, if we were just like going to drop somebody off, like HR person earlier in their career, and they want to get promoted like Maria, what are like a few things that you would tell them to do? Of like, hey, no matter what, things are going to go crazy, but do a few of these things and you're probably going to see some success.
Yes, absolutely. Well, I would say, not be afraid to say yes to different things, right? So I was lucky enough to have wonderful mentors in HR and operations, both here at UHS with Jerry Geckel, who is our former SVP of Human Resources, like amazing storied career in HR. She just received a Lifetime Achievement Award. And so whatever it was that she would put out there, getting involved in the community, looking at a course that you might want to take in executive comp, it was a yes, because I knew she was an amazing person. Actually, when I interviewed with her, I said, if I'm lucky enough for to be offered a job with this organization. I will never learn more than I will from her based off the rigor, the questions that she asked. I just knew. So that was one, like, great mentor. And then what that mentor is guiding you to, say yes and embrace it. Same thing when I started in gaming, also had another amazing mentor there. And it would be saying yes to things. Okay, hey, we're going to do this concert series. Would you be interested in managing the concert event staff? Yes. You know what? We kind of want to expand you from HR beyond that. And so we want to get you involved in operations. Yes. And those kind of things, sometimes are scary, but saying yes more often than not broadens you. And I think that is really good, and you have fun with it along the way because it's, challenging you and growing you.
I love that.
I do. I think you're the first person that's actually said that.
Yes.
And I did a speech on that back during COVID at a mortgage company headquarters who never went remote in Ohio. They stayed in the office, man. Hundreds of people every day coming to the office. And they brought me in to speak. And my speech was on the power of saying yes. And I just used my own background to help support that in the stories. But you could not be more right, Maria. Say yes. Just say yes, right?
Lean in.
Lean in. That is such a powerful self-improvement, self-development. Someone asks you, do you want to do this? Yeah, I do. Go figure, you'll figure it out. You'll prosper and you'll be better off on the other end of that.
Absolutely.
That is super good advice.
I love that.
Thank you.
Yeah, listeners, that's something you can do right now. Show up to work, get yourself a mentor, and start saying yes to things. That's easy, right? Pull through is a little hard, but that's okay. Just say yes. That's the easy part.
That's exactly right. And I think that is one of the things that I'm lucky about because, you grow up with hardworking parents and you kind of love the work and what that nets and the fruits of it. And, so that is one of the things that I would give people advice, and then the other thing I would say is I think being able to take constructive criticism really well. I love that feedback. I have to say, playing sports growing up and being part of a team, I've said this before, but I was lucky enough to play softball in college and I had played basketball in high school and tennis, but really gravitated more towards, softball, had played Little League as a kid. And why I really gravitated towards it is because at any given time, you're really just 1/9 of the equation. You're really, relying on every other teammate to do something good. You may get one hit, but then somebody needs to hit you in. Or I love the concept of sacrifice fly, sack bunts, right? Because, you're sacrificing your at bat to make sure your teammate moves forward. I always thought there was something very servant leadership about baseball and softball that I love because, a pitcher can throw a great game, but if you're making errors behind that pitcher, that support that you have to have for each other in every different way, rooting for each other to get a hit, you really know what that true team concept is. And I think that's kind of one of the other things I always say is that you really have to make sure you're rooting for everyone around you and for their success.
Isn't that the truth? More Maria, Bo. More Maria. Yes, we need more of this in life.
Yeah, for sure. You're the epitome. You're up here, Maria. You are the one we should all emulate.
I agree. UHS is very lucky to have you. Very lucky.
I think I'm the lucky one. I always say that I am the lucky one to be here. If I could just wear a UHS jersey with UHS on the front every day, I would do that. Exactly. I'm one of those people who, since a kid, always loved, that team loyalty and all that.
Yeah.
And so, I think it's in my DNA, and now UHS is in my DNA.
I love that. You should get jerseys made if you haven't already.
We did. I started a co-ed softball team when I started here, and so I do have a UHS jersey.
Oh, that's amazing. That's wonderful. Awesome. Well, Maria, this has been absolutely amazing. Can't say enough good things. So at the end here, we give everyone a chance to give a shout out. So for the next, however long you want, it's the Maria show.
Well, I just have to say, credit goes to our 96,000 plus employees who are dedicated to high quality care to our patients. I think that's the most important thing. We have incredible employees who just do incredible things. Our nurses, our doctors, our mental health workers, all across the board, our social workers, our therapists. That's where really the true credit goes. I'm just lucky enough to be facilitating in HR. And then our leadership team, I just have to say, from our president, Mark Miller, through every leader I'm lucky enough to work with, they are just such a great, collaborative, passionate group. And I have to say that, I'm humbled to work with them. And, and then I have to give credit to the mentorship that my former boss and mentor, Jerry Geckel, as our SVP of HR, I'm very lucky to have joined an organization where I had this opportunity. So just a thanks to all of those employees and fellow leaders and guides.
Oh, absolutely amazing. Maria, I can't thank you enough. I learned a ton on here. I know our listeners did too. From the look on Bo's face, he learned a ton too, didn't you, buddy? I think Bo cut out. That's all right. But
Come on.
Thanks so much. You're always welcome back. We'd love to have you back at any time. And listeners, that is a wrap.
Thank you so much.